Bismillahirrahmanirrahim. Let's study about anatomy MCQs. MCQs 1. A researcher is interested in learning more about individual perception of pain and develops a trial where participants experience electric shock. He applies a low-grade electric shock to a participant's right hand. Where would this information typically be processed by the participant's brain? Option 1. Left side of cerebral cortex. Option B. Both sides of cerebral cortex. Option C. Right side of cerebral cortex. Option D. Pain sensation is not processed by cerebral cortex. The correct option is left side of cerebral cortex. Next MCQ is which of the following areas of brain is not involved in diffuse cortical projection of dopamine? Option A hypothalamus, option B raphe option C ventral tegmentum, option D substantia nigra. The correct option is raphe. Next MCQ is Jenny receives a gold retriever puppy for her birthday. She picks up the puppy and is surprised at how soft and fluffy his fur feels. What lobe of Jenny's cerebral cortex first processed the information about the feel of puppy's fur? Option 1 frontal lobe, option B occipital lobe, option C parietal lobe, option D temporal lobe. The correct answer is parietal lobe. Next MCQ is which of the following correctly identifies male components in order from largest to smallest? Option 1, option A muscle fiber, fasciculus, myofibril, option B sarcolemma, sarcoplasm, fasciculus, option C fasciculus muscle bundle, myofibril, option D fasciculus muscle fiber, myofibril. The correct option is fasciculus muscle fiber, myofibril. Next MCQ is the space between two Z lines constitute the option is sarcolemma, option B sarcophagus, option C sarcoplasm, option D sarcomere. The correct option is sarcomere. Next MCQ is what is an aponeurosis? Option A segment of new muscle that is not attached to bone. Option B an area of smooth muscle in the abdomen. Option C a large flat tendon that anchors muscle. Option D a group of neurons that innervates striated muscle cells. The correct option is a large flat tendon that anchors muscle. Next MCQs. We would expect to find smooth muscle in all of the following except option A pulmonary circulatory tissue, option B esophagus, option C small intestine, option D myocardial tissue. The correct option is myocardial tissue. Next MCQs is curare is a naturally occurring compound that competitively binds to nicotinic acetylcholine receptor on muscle cells. Which of the following symptoms might be seen in patient who has been exposed to curare? Option A diaphragmatic paralysis, option B cardiac arrest, option C excessive salivation, option D muscle spasticity. The correct option is diaphragmatic paralysis. Next MCQ is which of the following type is accurate regarding type 1 and type 2 muscle fibers? Option A type 1 fibers store much of their energy as triglycerides, whereas type 2 fibers store energy as ATP or creatine phosphate. Option B type 1 fiber are easily fatigued and are therefore intended for short bursts of activity. Option C type 1 fibers employ anaerobic metabolism, where type 2 fibers utilize aerobic metabolism. Option D type 1 fibers are white, whereas type 2 fibers are red. Correct option is type 1 fibers store much of their energy as triglyceride, whereas type 2 fibers store energy as ATP or creatine phosphate. Next MCQ is which of the following is not innervated by the autonomic nervous system? Option 1, option A branching muscle cell, option B striated skeletal muscle cell, option C myocardial cell, option D intestinal muscle cell. The correct option is striated skeletal muscle cell.